Babies this young are extremely responsive to the emotions and the reactivity and the social interaction that they get from the world around them. This is something that we started studying 30, 40 years ago, when people didn't think that infants could engage in social interaction. In the still face experiment, what the mother did was she sits down and she's playing with her baby, who's about a year of age.
I'm like a girl. Oh.
And she gives a greeting to the baby gives a greeting back to her.
Yeah.
This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this, and then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, "Come on, why aren't we doing this?" Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it. They actually may lose control of their posture because of the stress that they're experiencing.
Okay. I'm here. And what are you doing? Oh, yes. Oh, what a big girl.
It's a little like the good, the bad, and the ugly. The good is that normal stuff that goes on, that we all do with our kids. The bad is when something bad happens, but the infant can overcome it. After all, when you stop the still face, the mother and the baby start to play again. The ugly is when you don't give the child any chance to get back to the good. There's no reparation, and they're stuck in that really ugly situation.
I'd like to introduce to you an exciting program being initiated by SPARKS. That is parental bonding. The bonding of parents with a newborn child. It is an exciting and important program, and we are in deep appreciation to Shandy and Moshe Laux for sponsoring this program. Bonding is extremely important. It's the relationship that parents develop, and of course primarily the mother, but the father is also involved in it, with the infant. And it's important to know that bonding is not an instant glue. It's something that takes time. It doesn't happen in the first day, it doesn't happen in the first week. But it is extremely important, and there's a great deal of research on the effect of bonding, that it strengthens the child's immune system. There's evidence that premature infants that have been stroked and cuddled gain 50% more weight than those who have not received that kind of cuddling. So skin-to-skin touch, smiling, cooing, staying with the infant. These are all ways in which the mother and the child bonds. If the child misses bonding, this can cause delay in the child's development of a feeling of security, a feeling of self-esteem. Yes, even at that early age, children develop feelings of security and self-esteem, or in the absence of it, anxiety. Now, some things may happen that may be barriers to the bonding. As for example, a mother goes into a severe postpartum reaction where she cannot give of herself to the child the way she would like to. And as I said, it is not something that happens in a day or a week, but it's a process. So even if, for whatever reason, the early few days are missed, bonding, healthy bonding can certainly develop. But it's important to keep in mind that the bonding in the early life can be a very strong determining factor in the child's physical and emotional health. And we think that because everything is in genetics, and since the child was born with genes, the child's personality and everything is cast in cement. Not true. There are alterations can be made, and even genes can be affected. Well, here again is where SPARKS comes in with their very effective postpartum program to give the mother the support that she needs to see that she gets the necessary medical care, to help the family understands what's happening, and to facilitate the bonding of the mother with the infant so that even with the postpartum condition, the mother can, at least as early as possible, develop bonding.
Hi, I'm Rifki, and I'm a mother and a grandmother. And I'm here to tell you what suffering from postpartum depression is, and matter of fact, any kind of depression and anxiety. It's a very, very real and painful experience which people tend to take very lightly, especially when it's a hormonal imbalance. Even the doctors don't take you seriously, thinking that it'll just go away once the pregnancy and birth is over. And actually, they have a statistic saying that it's 1 out of 8 moms that suffer from it. And unfortunately, I was one of them. I was in a very, very dark place. Many times contemplating suicide. The pain was so unbearable that I just couldn't see a way out. After the birth of my son 3 years ago, I thought that I would be ecstatic, happy, enjoying my sweet baby. And instead I felt intense anxiety. I felt I was trapped in my mind. My friends called saying how I was. I didn't answer the phone. I didn't go outside. I was anxious about his sleeping schedule and his eating schedule. And it's too late and I can't go outside. And I ended up feeling trapped in my mind. And honestly, in retrospect, I should have said something at that point. But, you know, I'm a new mom, so things can happen. But then it escalated into something very tough and severe. I ended up being hospitalized for 8 days because I was a wreck. I felt like giving up. I felt like giving up on everything. And really, no one should go through this.
After my wife Rifki had given birth to our youngest, she's been suffering and become very depressed. And it went worse from day to day. And I was at a loss. You know, I would go out, try to, go out to restaurants, try to buy her gifts, do everything that a husband would try to cheer up a wife, especially after giving birth. And things went from bad to worse, and we just didn't know, we were at a loss what to do.
When things escalated and my wife was hospitalized, you can imagine what I was going through. I just was married a year and a half ago, or before that. I didn't know what was happening. I thought I lost my wife forever. I didn't know, I couldn't make sense of what was happening with her whole situation.
Until one day I shared some of my pain with a neighbor, and luckily she had just come from a SPARKS awareness meeting,
and she understood what I was talking about. So she suggested I give them a call. She gave me their number. And I held on to the number for quite a while, thinking that this will just go away. Until one night, I felt so overwhelmed with a screaming infant in my hand. I just thought I'm losing it forever. I picked up the phone and dialed to Sparks. As soon as this wonderful woman named Esther picked up the hotline, I felt heard and understood for the first time.
Very grateful to Sparks for being there throughout this entire difficult ordeal. And the message that they gave me as a husband was that the more support I give my wife throughout this time, the sooner she will heal. And until that point, they'll always be there for you.
Luckily, we were financially okay, and we didn't have a problem with paying for the therapy and all the other healing options that they suggested. But can you imagine women that go through this and they don't have a way of paying for it? That's where Sparks comes in. They're there to guide and support and even pay for people who can't afford. And I don't have to tell anyone that when a mother is not functioning, the whole house just falls apart.
PPD, postpartum depression, is very healable. It's not a life-term illness. The sooner that a person speaks out, the sooner the healing can start, the sooner they can get their life back on track. And Sparks is there for that reason. They're there to help, they're there to hold your hand, and I'm grateful to them.